I would like to make a couple of logistical announcements. Today's webinar will last approximately 1 hour and is being recorded. The webinar recording and PowerPoint presentation will be posted next week on the HUD Homelessness Resource Exchange website, www.hudhre.info. Also, as an attendee of this webinar, your microphone will be automatically muted. Next slide, please. We recommend using your phone rather than your computer speakers to hear the audio for today's presentation. Due to the large number of attendees, there may be a slight delay in the advancement of the slides. If you experience any other technical difficulties, please request assistance by using the questions box in your GoToWebinar toolbar. Next slide, please. The questions box is also the place you can submit your content questions. All of your questions are important. Due to the volume of questions or other issues, we may not be able to address them all at this time. If we don't answer your questions, please submit them to the virtual help desk. Please remember to reference this presentation, Preparing for Your 2013 Housing Inventory and Point-in-Time Counts, with special attention to veteran program guidance in your question. We'll also send you a brief webinar evaluation at the email address through which you registered for today's webinar. Please respond to the evaluation so we can continue to improve the delivery of future webinars. As a reminder, participants in this call are muted, but you can submit any questions that you have via the GoToWebinar toolbar on your screen. Next slide, please. Upon completion of this webinar, participants will be able to understand changes to the HIC and PIT count in 2013 relevant to VA programs, understand what data needs to be collected specific to homeless veterans and VA programs for the HIC and PIT count, and to understand how to access resources on the HUD HRE related to the HIC and PIT count. Next slide, please. The original HIC and PIT webinar was held on October 2nd. The video presentation and guidance document can be accessed via the HUD HRE. Additional guidance on counting homeless youth and some updates to the guidance document will be posted soon. And now I'd like to turn this over to William. William?
Thanks, Mike, and thanks everybody for your patience. On behalf of HUD, I want to welcome everybody. We're excited to have this webinar. You know, it's a really busy time, especially for COCs. It's the end of the year, so everybody, I know our VA staff as well, we're gearing up for a holiday, and most people will be out, especially for COCs, once we can get some of those applications in, I'm sure. So given the lateness in the year, I'm sure some of you are asking why are we having the webinar today? So I thought I'd address that quickly. As we saw, the purpose of the webinar is to provide our partners in the VA some quick guidance and some overview. And a lot of this is to discuss some of the reminders of the count. For those of you who listened to the webinar in early October, much of this will be a repeat with an added emphasis on the interaction with the VA. I would also add, as Mike mentioned, that we're working on an update to the guidance that focuses specifically on homeless education liaisons and runaway and homeless youth providers. You know, we've asked that that communities engage those youth providers in particular and find ways to make sure we're accurately counting them. And there have been some questions that have come up as a result of that, and we'll try to address them. We apologize that it's coming a little later than we had hoped. But we'll try to give you more tips and pointers is really what it is than specific guidance or things you have to do, but we're going to tell you how to characterize your HHS runaway and homeless youth programs to the extent you have some. So as many of you know, in 2010, the U.S. Interagency Council on Homelessness published Opening Doors, Federal Strategic Plan to Prevent and End Homelessness. And this has been a great impetus for more collaboration and a focus on working to end homelessness. HUD and the VA have since aligned their national agency goals to work towards ending veteran homelessness by 2015. The intent of this partnership is to both increase collaboration among providers at the local level and improve service and efficiency for our homeless veterans. There's been a big push to include VA grantees in HMIS and to remove barriers for services. And we'll continue to work together to improve how we serve our homeless veterans. I want to thank our VA partners for being willing to work with us. We look forward to uniting together to end veteran homelessness. I'll now turn the time over to John Kuhn from the VA.
Thanks, William. Good afternoon. Good morning to some of you. As everyone is well aware, the VA is driving to end homelessness among veterans, and we use the PIT to measure our effectiveness in meeting that goal. So the PIT is vital because we also need to know that we're matching our resources with the needs we find. So in 2011, the VA began working more actively with the COCs in identifying homeless veterans for the PIT. As this is a mandatory year coming up, a mandatory count year for unsheltered persons in 2013, your work with the COCs in identifying homeless veterans, whether they're in VA homeless programs, the streets, encampments, and so forth, are really critical in our primary mission of ending homelessness among veterans. Because again, if we're not matching resources with need, there's really no way we're going to be successful. So we've asked, next slide please. So we've asked all VA-funded community-based programs already in the past couple of years, really grant per diem, the HCHV contract care beds, SSVF, and VHPD to enter data into HMIS. So that way we've been able to get all that sheltered, for all veterans who are homeless in shelter, we've been able to get that information on a consistent basis and understand for the sheltered count at least, the number of homeless persons. And this is where the unsheltered count is so important, because here we are having an opportunity that really only comes up once every 2 years, as it does in January. So we, again, really need your involvement with the COCs to help identify those veterans who might otherwise be missed. Ultimately, we want to share basic information from the VAs with the COCs so that homeless veterans seen in the VA can be included in the PIT, even if they are not counted in HMIS. Next slide, please. So the way we plan to share that information is through what many of you have already heard about, is the homeless registry. Now the registry, for those of you who don't know, is a VA tool that collects information about the services that are provided to homeless veterans. And we expect that the first result of this effort to share information with the COCs from the registry should be available in the coming calendar year. The VA is currently working to develop a system where COCs can send electronic queries to the VA to determine whether somebody is a veteran. And that would be in real time. So if you're a provider to veterans and you're working in a community-based homeless service, not even one that's necessarily directly aligned with the VA, if you wanted to know if John Doe is a veteran, you could identify that by a simple electronic query to the VA. Now, over time, we want to be able to share more information, but as you well know, there are some privacy issues we have to attend to, and there are also significant technical hurdles because although it's relatively easy for the VA to collect information since there's only one VA, we're talking about sharing information with roughly 440 COCs, each with a different set of rules, each with potentially different vendors who operate their HMIS systems. So it's quite complex, but we are working towards sharing that data as much as we are able. But the theme here for today is, yes, certainly we want to begin to get that data out, but we want to make sure that we're working closely with the COCs so that they can collect all the information they would need, so that way we have access to the information to make informed decisions about providing appropriate levels of support and resources to homeless persons throughout the country, and also understand how our services are impacting upon the homeless population and whether we are in fact effective in delivering services to drive homelessness down to our goal of 0. And William, on to you.
Thanks, John. We appreciate all your work and we appreciate your team. This is some exciting stuff, and obviously we're aware that there are challenges as we move forward, but we're committed, I know, between HUD and VA to overcome barriers, to look into privacy, look into safe sharing, and try to do our best to help these homeless veterans. So we really appreciate all of VA's work and everybody here on the phone. I know COCs, this is a lot of work, and all of the partners in the medical centers and everywhere. There's been just a big effort, and it will continue to be an effort, and we're committed to help out on it. So we appreciate everybody on this. So as we jump into some of the updates, I wanted to give a quick overview again of what the HIC and the PIT are. The Housing Inventory Count, or HIC, comprises the beds and units that are considered part of the COC homeless system. beds and units in the HIC must be dedicated to serving homeless persons. The point-in-time count, or PIT count, provides the homeless assistance community a picture of the overall homeless population and some basic subpopulation information. HUD requires that COCs conduct an annual count of homeless persons who are sheltered in emergency shelter, transitional housing, and safe havens on a single night. COCs must also conduct a count of unsheltered homeless persons every other year, or odd years. 2013 being an odd year, COCs are required to conduct both a sheltered and an unsheltered count during the last 10 days of January. Next slide, please. So I wanted to highlight just a few of the changes as they're relevant to our VA partners. So changes to the 2013 HIC are relevant to both VA-funded programs and veterans in general include, first, rapid rehousing has been added as a new provider program type due to the changes to the ESG and COC programs for the HEARTH Act. Second, the supportive services for veterans' families, or SSVF programs, that provide rapid rehousing assistance should be categorized under the rapid rehousing provider program type. And third, all programs with inventory that have been identified as under development will need to indicate whether the provider program is expected to begin operating within the next 12 months. Next slide, please. So for changes to the 2013 PIT count, there are four. First, COCs will be required to report on the number of persons in each household type by one of the following age categories: under age 18, age 18 to 24, and over age 24. As a result, COCs will need to collect age data for each person in the household. Second, COCs will need to collect gender data for veterans in order to report the number of female veterans. Third, veteran status should be collected for all adults in the household, not just the head of household. And fourth, veteran status should be collected on both sheltered and unsheltered populations, including for persons sheltered in non-veteran programs. So that's a quick overview of some of the changes we have in 2013. I want to turn the time now over to Tracy Dialano to discuss the housing inventory count guidance for 2013.
Thanks, William. So in this section, we will cover the housing inventory count, or HIC. Next slide, please. And we should be on slide number 15. So let's review what we need to include in the HIC. For the purposes of the HIC, a provider program with dedicated beds and units is one where, number one, the primary intent of the program is to serve homeless persons. Number two, the program verifies homeless status as part of its eligibility determination. And number three, the actual program clients are predominantly homeless. Note that beds in institutional settings not specifically dedicated for persons who are homeless, such as detox facilities, emergency rooms, jails, and acute crisis or treatment centers, should not be included in the HIC. While there may be occasional instances where a provider program with dedicated beds serves a non-homeless person, beds in these types of programs may still be counted as dedicated beds. So, for example, a provider program that is intended to serve persons who are both homeless and intoxicated may be unable to determine homeless status at entry due to the person's severe intoxication. But let's say after admission, the provider program determines that the participant is not homeless and helps them to return to their own housing. In this instance, the provider program bed may still be counted as a dedicated bed for homeless persons. Next slide, please. It is becoming increasingly more important to recognize the relationship between your continuum of care HMIS system and the HIC and the PIT. Think of HMIS as the place where data is collected, and the HIC and the PIT on the HDX as one of the places where data is reported to HUD. The housing inventory count is based on program descriptor data that is used to establish and set up programs in your HMIS. According to the HMIS data standards, which were updated in March of 2010, all homeless assistance and homeless prevention programs, including VA-funded homeless programs, that are part of your continuum of care homeless system must have program descriptor data recorded in the COC's HMIS. Program descriptor data recorded in HMIS, things like beds and units, should be used to complete the HIC and should match the HIC data reported by the COC. All right, next slide, please, and we should be on slide number 17. There are 5 provider program types, and the VA is actually funding programs in each one of these categories. These include emergency shelter, transitional housing, the new provider program type rapid rehousing, safe havens, and permanent supportive housing. We'll go over the VA-funded programs and where to categorize them in the upcoming slides. All right, let's go to slide 18. Next slide, please. COC should coordinate with the Veterans Administration and the VA-funded provider program staff on an annual basis to review and verify inventory that should be included on the HIC. Continuums of care need to include all VA-funded programs in the HIC, regardless of whether or not the program is entering data into HMIS. The VA programs should all be reported with the appropriate prefix for the program, as will be listed in the following slides. Please note that this information can also be found in Appendix A of the data collection guidance, which has already been posted on the HUD HRE. So you don't have to worry about taking a lot of notes. You can download the document, and it'll show you where all the prefixes are. COC should include prefixes for VA-funded programs, even if only a portion of the program is receiving funding from the VA. Okay, let's go to the next slide, please. So our first category are emergency shelter programs, and this includes 3 VA-funded programs. Include both the HCHV Emergency Housing Program and the HCHV Residential Treatment Program under Emergency Shelter. Note that the prefix includes a /EH or a /RT to indicate the different programs. Domiciliary care for homeless veterans is also categorized under emergency shelter and use the prefix VA-DOM. All right, next slide, please. So let's talk about the transitional housing programs. The VA-funded transitional housing programs include both the grant and per diem program with a GPD prefix and the compensated work therapy transitional residence program with the prefix CWT-TR. All right, next slide, please. The HCHC Community Contract Safe Haven programs should also be categorized underneath the Safe Haven Provider Program type. Please use the prefix HCHV/SH. Next slide, please. So we should be on slide number 22, and we are. SSVF programs are categorized underneath the new provider program type, RRH, for rapid rehousing. Note that COCs will need to know the number of persons housed in the SSVF program on the night of the HIC and the PIT count to measure program utilization. Additional direction on how to count SSVF beds will be covered on the next slide. However, since persons who are housed in the SSVF program are considered permanently housed, they will not be included as homeless in the point-in-time count. All right, let's move to the next slide. So let's talk here a little bit about how to report supportive services for veteran families programs on the HIC. Similar to HPRP, SSVF Rapid Rehousing Provider programs may offer both homeless prevention and rapid rehousing assistance to households. Rapid rehousing assistance in households are not reported as served unless a service record has been entered into HMIS. Therefore, continuums of care must take additional steps to identify and count SSVF Rapid Rehousing Inventory. COC should only count SSVF Rapid Rehousing beds and units that meet all of the following criteria. Number 1, SSVF participant is actively enrolled in the provider program on the night of the inventory count. Number 2, SSVF participant housing status at program entry is literally homeless. Number 3, SSVF participant is no longer literally homeless and is in permanent housing on the night of the inventory count. And number 4, SSVF participant is receiving financial assistance and or housing relocation and stabilization services on the night of the inventory count. COCs will typically need to verify participants' housing arrangements on the night of the inventory count with the agencies operating rapid rehousing provider programs, as this may not be tracked in HMIS. Note that when a single SSVF provider program operates in multiple COCs, each COC should have provider program descriptor data pertaining to that provider program in their HMIS. Beds should be apportioned according to which COC the housing units assisted by the vouchers are physically located in. SSVF programs that are located in multiple COCs should determine the correct distribution of beds and units and provide an accurate count to each continuum of care. All right, let's move on to the next slide, and we'll talk about the HUD VASH program. So the HUD Veterans Affairs Supportive Housing VASH program should be categorized under the Permanent Supportive Housing Provider program type with the prefix VASH. Similar to SSVF programs, since persons housed through the HUD VASH are considered permanently housed, they will not be included as homeless in the point-in-time count. You will, however, need to know the number of persons served in the VASH program on the night of the count to determine utilization rates on the HIC. All right, let's move to slide number 25. And we're going to talk a little bit more about how to count VASH vouchers. Continuums of care should count the total number of VASH vouchers available for use on the night of the HIC and PIT count, regardless of whether or not the voucher is presently being used. So if your COC received an allocation of 100 vouchers, but only 50 of them are currently occupied, you should report all 100 vouchers on your HIC. You want your housing inventory count to portray the total capacity of beds and units within your system. In addition, vouchers should be reported based upon where they are actually located. COCs should contact their local public housing authority and or VA medical center that administers the VASH vouchers to determine the total number of vouchers available within their continuum of care. When a single provider program operates in multiple COCs, each COC should have provider program descriptor data pertaining to that provider program in their HMIS, and beds should be apportioned according to which COC the units assisted by the vouchers are physically located in. Whew. All right, let's move to the next slide. Another relevant HIC data element to the Veterans Administration is Target Population B. Target Population B is used to identify 3 specific subpopulations if applicable. A population is considered a target population if the provider program is designed to serve that population and at least 3/4 or 75% of the clients served by the provider program fit the target group descriptor. Note that a single provider program may not have more than one target population B. All right, let's move to the next slide. And we're going to talk about VA HMIS participating beds. Note that a bed is considered an HMIS participating bed if the provider program makes a reasonable effort to record all universal data elements on all clients served in that bed and discloses that information through an agreed-upon means to the HMIS lead agency at least once annually. For provider programs that serve mixed populations without a fixed number of beds per household type, record participating beds according to the detailed instructions that are provided under household type in the 2013 HIC and PIT data collection guidance that's already been posted on the HUD HRE. Well, that's it for the HIC, and Lauren Dutton will now go through the next set of slides focused on the PIT.
Great, thanks, Tracy. Next slide, please. Okay, so as William reviewed at the beginning of the presentation, in 2013, all COCs are required to conduct both a sheltered and an unsheltered count. The count must be conducted during the last 10 days in January, and the count should be aligned with the HIC process that is in place in the COC that Tracy just described in the previous portion of the presentation. Both the unsheltered and sheltered counts must be completed using statistically reliable methods that are approved by HUD. Please consult the Guide to Counting Sheltered Homeless People and the Guide to Counting Unsheltered Homeless People that are available on the HUD HRE website. COCs are encouraged to use HMIS to generate their sheltered count where possible. More guidance on using HMIS for shelter counts is provided in the Shelter Guide on HUD HRE. Next slide. So I just want to spend a couple minutes to talk about who should be included in the sheltered count. COC should include all of the individuals or families who meet the criteria described in paragraph 1(2) of the homeless definition final rule. This includes people living in privately or publicly operated congregate shelters, transitional housing, and hotels and motels that are paid for by charitable organizations or federal, state, or local government programs. This also includes people who are residing in safe haven programs. Please note that rapid rehousing, persons staying in rapid rehousing are considered in permanent housing provider programs. However, homeless households currently residing on the street, in an emergency shelter, transitional housing, or safe haven, but are also enrolled in a rapid rehousing program and awaiting placement at the time the point in time is conducted, should be counted based on where they reside on the night of the count. So rapid rehousing assisted households who are still unsheltered on the night of the count should be included as part of the unsheltered count. Next slide, please. The unsheltered count should include all individuals or families who meet the criteria described in paragraph 1(1) of the homeless definition final rule. This includes persons with a primary nighttime residence that is in a public place not designated for or ordinarily used as a regular sleeping accommodation for human beings, including a car, a park, abandoned buildings, buses or train stations, airports, camping grounds, or any other outdoor location on the night designated for the count. It's important for COCs to remember that this year they must report complete subpopulation information for the unsheltered persons as well as sheltered persons. Next slide, please. So who should not be included in the point-in-time count? COCs should not include people who are residing in permanent supportive housing programs in the point in time, and this includes the VASH program. They should not include people who are in locations that are not listed on the housing inventory count. Tracy went over that a little bit, but that might include detox centers. People temporarily staying with friends or family, you may consider them to be couch surfing or doubled up. They should not be included in the point-in-time count. And people who are residing in their own unit with assistance from a rapid rehousing provider program in the night of the count, and that would include the SSVF program. It's important to remember, though, that persons in permanent supportive housing programs, while they are not included in the point-in-time count, they still should be counted and reported on the housing inventory count chart so that HUD can understand program utilization. Next slide, please. The household types for the point-in-time count are the same as in prior years. Persons in household with at least one adult and one child. Typically we think of those as families. Persons in households with children. This would include singles, adult couples, and groups of adults. and persons in households with only children. And that would include persons who are under age 18, children in one-child households, adolescent teens and their children, adolescent siblings, and any other household composed of only children. This year, COCs will be required to report on the number of persons in each household type by one of the following age categories: persons under 18 years of age, persons ages 18 to 24, and persons over age 24. As a result, COCs will need to collect data for age data for each person in the household. Next slide, please. Beginning in 2013, COCs no longer need to collect and report data on the number of sheltered and unsheltered unaccompanied children. That data is going to be captured in the new household type age reporting requirements. However, as I mentioned previously, this year COCs will be required to collect and report on the number of sheltered and unsheltered persons in each of the defined subpopulation categories. Most important for VA programs, this includes a new subpopulation category for female veterans. So all of the subpopulation types are displayed on your screen, but I'll go through them quickly. They are chronically homeless individuals, chronically homeless families, persons in chronically homeless families, all veterans, the number of female veterans, the number of severely mentally ill, the number of persons with chronic substance abuse problems, the number of persons with HIV/AIDS, and then this year it is optional to report on the number of victims of domestic violence. Next slide, please. In an effort to collect accurate data on the number of veterans in the COC, HUD recommends that the COCs closely examine questions that are used to determine veteran status during the count. HUD, in coordination with the VA, has developed some questions to ensure the accuracy and improve enumeration around the number of veterans. So the recommended questions are displayed on your screen. I'll just take a minute to read through them for you. The first part of the recommended question would be, have you ever served on active duty in the U.S. Armed Forces, such as served in a full-time capacity in the Army, Navy, Air Force, Marine Corps, or Coast Guard? The second component of the question would be, were you ever called into active duty as a member of the National Guard or as a reservist? A second supplemental question that is recommended is, if you are unsure if you are a veteran, have you ever received health care benefits from a VA center? Next slide, please. So here are just a few closing reminders about conducting the point-in-time count in 2013. COCs will be required to report and explain their point-in-time counting methodologies that were used for both the sheltered counts and the unsheltered counts. So they will, for the sheltered counts, the recommended methodologies that HUD recognizes include survey, using HMIS, extrapolation, and other methods. And then for the unsheltered count, the methods would be a public places count, a service-based count, observations, interviews, and sampling. These are similar categories to what is reported as part of the COC application. It's also important that COCs remember that collecting information about the number and characteristics of homeless veterans is a very important step to understand and measure progress towards ending homelessness among veterans by 2015. And lastly, it's important to remind COCs that they should report to HUD only persons who meet the Category 1 definition of literally homeless. So COCs may choose to count persons who fall under Category 2, 3, or 4 at-risk definitions for local planning purposes, but this data should not be included in the number of persons that are reported in the point-in-time count to HUD. So if your COC chooses to collect any additional information, it needs to make sure that that information can be separated out for reporting purposes to HUD. With that, I will turn the presentation back over to our moderator.
Thank you very much, Lauren. We've come to the end of our webinar. You should now be able to understand, first, changes to the HIC and PIT count in 2013 relevant to VA programs. Secondly, what data needs to be collected for the HIC and PIT count. And lastly, how to access resources on the HUD-HRE related to the HIC and PIT count. The 4 resources listed on this slide are available for downloading on the HUD-HRE. In addition, HIC and PIT data entry guidance will be posted on the HUD-HRE in January. Next slide, please. Thanks for taking the time to attend. If you submitted a question that we did not answer, be sure to submit it through the virtual help desk. Finally, please complete the online survey to tell us how well this webinar met its objectives. Also, we're excited to begin offering attendees of this webinar and all future Ready, Set, Go webinars the ability to mark this course as complete in the learning management system so that you can add it to your learning transcript and track your learning. You'll receive a link via email to complete both later today. Please join us tomorrow, December 18th, for the next webinar in this series, Homeless Programs, Transition, Policies, and Changes. Once again, on behalf of the SNAPS office, thank you. Enjoy the rest of your day.